Hi, I'm Dr. Joanne Smith.
And I'm Dr. Krenda Hankins.
And this is A Pod Full of Pediatrics. This is the one where we talk about the hepatitis B vaccine. Disease and vaccine.
Disease and vaccine, that's right.
Yeah. So hepatitis B disease is a global public health problem.
It is, yeah. It's estimated that there's more than 250 million hepatitis B carriers in the world, of whom approximately 800,000 die annually from hepatitis B related liver disease. It is spread by bodily fluids, blood primarily, but also other secretions.
Right. And Hep B is interesting because it can cause an acute infection that you get really sick fast, or a chronic infection that gets you sick over the long term.
Yeah, and that chronic infection, and actually even in the acute or chronic infection, interestingly, that can both lead to failure, like liver failure and death. For the acute infection, there are people who clear it.
Right.
Like they actually, their body takes care of the hepatitis
But mostly
B.
adults.
Mostly adults, that's right, which not children, or not very commonly cleared in children. But that chronic infection are people who are not going to clear it. Either the adult or the acute or chronic can lead to liver failure and death.
Yes, it can also cause liver cancer, something called hepatocellular carcinoma. Which is more common to be caused in kids than adults.
Yeah, and the incidence of acute hepatitis B infection in children less than 15 years old was less than 0.2 cases per 100,000 population in 2015, and has fallen further to 0 per 100,000 population aged less than 19 in 2022. This, and we really want to emphasize this is a win for public health.
Like literally got rid of the disease because of the vaccine.
Right. So we started this vaccine, and we'll talk about how we started
being
it.
the public health, not us personally.
Not us personally.
Yeah.
I had nothing to do with the vaccine.
No, it was before our time.
It was way before our time. I was not even out of high school.
Exactly. Wait, we were out of high school.
Oh, that's right. I wasn't out of college. Okay. But I definitely was not doing
No, we were definitely not having any authority at all.
But this really, when we started kind of changing and treating hepatitis B as a public health entity, where we started giving the vaccine, was about 30 years ago. And that has decreased the rates of, like, basically people under 40 don't have hepatitis B.
Right. And really that universal vaccine, which means all babies get it, has just decreased this as a problem for everyone.
Yeah, it's phenomenal. It represents a 90% decrease since 1991, when recommendations for the universal HPV vaccine of infants were implemented. Most new cases of acute hepatitis B are reported by the Centers for Disease Control and Prevention in 2022 were in people over 40 years of age. So that means they did not get the universal vaccination, were not eligible for it.
Yes. So acute Hep B is pretty much the same in kids and adults. It starts, the incubation period is really long, 1 to 4 months after exposure, right? And it starts with like a serum sickness, which is like joint swelling, pain, rashes, nausea, appetite suppression, just abdominal pain, feeling terrible.
And then those symptoms generally disappear after 1 to 3 months, but a lot of patients will go on to have a prolonged fatigue, even after tests improve.
And infants born to mothers with chronic Hep B are the ones at the highest risk of having this acute fulminant Hep B.
And that's the acute form, where they just get sick fast. It's like, so this means moms have this chronic HPV infection. They actually might not be that symptomatic at the time that they deliver their baby. But those infants that they deliver are by far at the highest risk of this fulminant hepatitis B and liver failure.
And chronic Hep B is often asymptomatic in adults and children. Sometimes it can cause some kidney issues in kids. But although the frank cirrhosis, right, liver failure is unusual during childhood, the development of moderate or severe fibrosis, which eventually will cause cirrhosis as an adult, is really common.
So, and what we're really saying here is that while the fulminant form is really dangerous in that early infancy, even if they have a chronic form where they aren't sick in that early childhood, by adulthood, often these children who are now adults are having severe liver problems.
Yeah. Babies with mothers who have chronic Hep B can have an increased risk of liver cancer about 5% of decades of their life. So they're just never completely safe from getting sick from Hep B.
Yeah, it is really a devastating disease over a lifetime, and it can take a lifetime to really present and get worse, or it can be really bad at the beginning.
And there's no treatment.
There is no treatment.
Yeah.
There is kind of like there are some antivirals they try.
Yeah.
Like it's got about a 25% efficacy for an antiviral. It is not very good.
No.
And there's significant side effects.
Yeah.
Significant side effects.
So each year in the U.S., an estimated 25,000 infants are born to women who are hepatitis B virus carriers.
And this is despite the fact that we screen women in in pregnancy.
Well, we are encouraged to screen women in pregnancy.
Yes, we try.
We try.
So 25% of these babies are approximately. Oh, sorry, I'm lost. You have to cut this out. Sorry.
Yeah. So as many as 90 out of these babies who are born to moms who are Hep B positive will get acute Hep B, like we talked about, that really bad illness at the start if no preventive measures are taken.
And then if a child catches hepatitis B virus during infancy or early childhood, because here's the other weird thing about hepatitis B is that it can be passed through other secretions, right? So yes, you're more likely to get it during the whole birth process, because man, there's a lot of secretions.
Yeah, there is a lot of body fluids being shared.
A lot of body fluids. But even after that, if you go home, breastfeed, do other things, you can actually still give your child hepatitis B.
And between 25 and 50% of children who are infected before 5 years of age will become carriers, whereas for adults, it's only 6 to 10% of affected adults become carriers. So kids are just more likely to get chronic Hep B.
Right. They just don't clear it as well as adults do.
And the thing about chronic Hep B is, like we talked about, most people are asymptomatic. They don't even know they had it. And so infants and children can come into contact with other people in their house who are chronic Hep B carriers. Not even if their mom is negative, there are still other people who could spread it to them.
And it is sneaky.
Yes, it can live on surfaces for a long time.
Yes, you don't know that it's there. And so you can infect children in other ways, not just through the birth process.
Yeah.
And many infected people who have chronic HPV might not know they have it.
Hep B.
Hep B.
Also HPV, though.
Oh, I said HPV. Sorry, Hep B.
So that's why we wanted a vaccine, because it's a sneaky virus and we needed to shut it down. So the virus itself was discovered in 1965 by Dr. Baruch Blumberg, who won the Nobel Prize for its discovery. And it was originally called the Australia antigen because it was named for Australian Aborigines blood sample that had reacted with an antibody in the serum on an American hemophilia patient.
The first vaccine was approved in 1981, which was the Heptavax. It was an inactivated type of vaccine, and we have talked about these before, but basically inactivated types, they take a part of the virus, right, that is live, and then they subject it to multiple steps to inactivate those viral particles. And basically those can include things like formaldehyde and heat treatment, pasteurization, but you go down to basically the tiny little viral particle that can be left that can still mount a
trigger an immune response, but also be safe.
Right, and also be safe. That vaccine was actually discontinued in 1990 and is no longer available in the US. And some of that reasoning behind that was because they, again, didn't want to use these other like serum-based vaccines, and were looking for other ways to make vaccines that, even though they hadn't found problems with the serum-based vaccines, that would still be more safe.
Yeah, and as we talked about before, right, public health has always been constantly changing. The vaccines have been studied and evaluated and reconfigured to be like, how can we get a better vaccine with less side effects that's just as effective?
And safe.
And safe, right?
And so this was actually an amazing vaccine. The
Right.
Recombavax is a genetically engineered vaccine, one of the first ones that basically it's recombinant in the sense that it kind of joins two things to be able to kind of trigger that immune response. And it did it through actively having the hepatitis B in yeast cells.
And then that came out, the recombinant came out in 1986, and then 1989, the second recombinant Hep B vaccine came out, so Engerix. So Recombavax and Engerix.
These were, again, game changers. We talk about this being a lot of game changers because it really is.
Right, exactly.
So what they decided is that, like, because our system is difficult, because we don't always know if moms have hepatitis B, because we aren't always able to, like, not all moms can afford like care during pregnancy, right? In the US, they were like, we're going to offer this vaccine because it is really safe and effective. And I mean really safe. No fevers.
No.
With hepatitis B. I've never, like, in 30 years now
yeah.
of giving hepatitis B, I've never seen a fever caused by hepatitis B vaccine in the newborn phase.
So in 1991, it started to be recommended for all babies at birth.
Right. And it was a strategy really to eliminate hepatitis B virus transmission in the United States. And as we talked about before, it has worked.
It has really worked, right? We went to 0 cases in 2022.
Yeah, 0 cases of people under 40, right, who have had this vaccine. What an amazing, like, change that has happened from one vaccine that we give to babies right after they're born.
Yeah. And, you know, we've talked about it's important, this universal vaccine, because not all moms are tested right before they deliver, right? So they may be tested earlier in pregnancy and may have contracted it later in pregnancy, and they're asymptomatic.
Right, because we don't always know that we have it. It is sneaky. Yeah. The other reason is because we don't have the best health care in the United States. It is really expensive to have a baby. And some would say prohibitively expensive to have a baby. Right? So if you are going to see your doctor, which you should be doing, if you are going to get ultrasounds, which you should be doing, if you're getting all the labs, which you should be doing, all of those things add up. And not everybody has the money to pay for those. And we don't have universal health care. No. So this is not free. And so there are a significant portion of women who don't actually get the care they need. And that's really what we're focusing on for these.
But besides that, say second, the mom is not the only source for hepatitis B exposure, right? Other household members can be asymptomatic carriers. I mean, this is something that as a healthcare worker, I was so thankful there was a vaccine when I had my kids, because I really could have been exposed to Hep B and never have known it. And even though I tested negative, like, it could be there in my life and therefore affect my baby.
Right. So by the end of 2018, 189 countries adopted universal hepatitis B vaccination programs, which has dramatically reduced global prevalence of hepatitis B in children less than 5 years of age, from about 4.7% in the pre-vaccine area to now less than 1%. And that was actually in 2015. So it's even less than that in 2022.
Yeah. So we talked about the 2 vaccines, Engerix and Recombavax. Now there's also combination vaccines that include the Hep B, Pediatrix, and Vaxelis. And they're all super safe and really well tolerated. I mean, yes, maybe the baby's a little fussy and has a pain at the site of injection, but it's hard to tell that in a newborn baby.
And it definitely does not prevent their feeding. It does not prevent anything like that. There have been no studies that have shown any change in the newborn period by giving the hepatitis B vaccine.
And, you know, there has been some potential association with things like optic neuritis and multiple sclerosis that have absolutely been disproven. Nothing to do with the hepatitis B vaccine.
Yeah, these vaccines are very safe and very effective. Unfortunately,
yes, here we are in 2026.
Yes, and we have really some new changes that were made through the ACEP, which is the kind of group that determines what vaccines to give. And they most recently met in December, and they stopped recommending universal Hep B vaccine. And we just really want to emphasize this. This was not based on any study. Mm-mm. It was not based on any
Nothing
findings.
New has happened.
Nothing new has been shown or evaluated or come out to light in anything. Nothing. Nobody really knows why they did this, but it will definitely affect really the safety and of children all over the world, not just in the United States.
Right. And one of the things that was said was that because we give too many vaccines.
Right. And so that's actually kind of the myth we're talking about today. Because actually it wasn't even an ACIP recommendation, but just the leader for the Department of Health and Human Services came out and just said, we give too many vaccines in the United States. He really made a unilateral change to the vaccine schedule. Again, no new data, no new evidence, but really political and ideological reasons. And that's it. Like, there was no other reason cited. So that is very important to recognize, that these now recommendations that are coming from our HHS and are not based on any scientific evidence at all.
And supposedly this is a public health department, but this is not a public health choice.
No, it is not a public health choice. And a lot of this they say is that we just give more vaccines than any other country. Well, that's not actually true. We don't. There are other countries that vaccinate for 17 different diseases. But because of this really, I don't know, really love of Denmark.
It seems like a great country. I don't know.
Like, they picked Denmark, I don't know, to model our vaccination schedule after, and they only vaccinate against 11 diseases.
And so we talked about this. It's like, instead of just comparing apples to oranges, it's like comparing apples to watermelons.
Yeah.
Right?
Denmark is so different than us.
It's like one state here, right?
It's one state in the United States. Like, that's about the size of Denmark as a country. And Denmark, truthfully, is pretty awesome.
It has universal health care, right?
Yeah.
Which means that it is free and comprehensive. So everyone who is a Danish citizen, or I think even just lives there as a resident, has access to health care at all times.
Yeah. I mean, it is pretty darn impressive in the fact that not only are they completely free for all of healthcare, but they have really seamless integration of follow-up and social help and aid for people in their country. It is really amazing. Every mom can receive healthcare free. Every child can go to get their services for free. Follow-ups are really well done because they have people calling and helping, and again, it's free.
They probably just have one EMR. They probably have one electronic medical record. They don't have to depend on people communicating.
They have amazing background medicine. I mean, this is why actually all the studies out of Denmark have been some of the strongest to show that vaccines don't cause autism, because they follow everybody.
Yes.
Their vaccine and data recording is phenomenal.
And why don't they give the RSV vaccine? Why don't they give that in Denmark?
Well, I love this because this is my favorite thing about Denmark, is that, do you know how much maternity leave they give their people in Denmark?
They get them through their childhood diseases, infant diseases, right?
Families get 46 paid weeks of maternity leave.
Do that
in
math.
Denmark.
That's almost a year.
Almost a year.
Mm-hmm.
So again, they, some of the ones that we are now not recommending, like RSV,
we'll say the U.S.
Sorry, the U.S.
HHS.
Human Health and Services are not recommending. One of those is RSV, which we've already talked about, is such a big change.
Yes,
because
it's prophylaxis, right? It's antibodies to be like, here, give a chance to fight out the disease, right?
They don't have any response. There's no side effects for the RSV vaccine or the RSV antibody. And we've had a 90% reduction in admissions just in the last year that we started using it regularly.
Yeah.
Now we're not going to recommend it anymore. For no reason, no new studies, no new effort, just because Denmark doesn't do it. Well,
Denmark doesn't need to. Their kids don't go to daycare
in
the first year.
They don't go to daycare for the first year.
By the time they get RSV, they can handle it, right?
They don't have families who have to put their kid in daycare because they can't afford health care.
Right.
If both parents aren't working. They can't afford food if both parents aren't working. They do not have those problems in Denmark.
Yeah.
So that is a huge difference between our countries. And one of the reasons why we should not be making recommendations to the vaccine schedule or changes to the vaccine schedule based on another country's experience.
Right.
But one of the things that they did, of course, is the hepatitis B, which, again, this is a great example of, in Denmark, why it's different.
Mm-hmm. Yeah, so Denmark, we talked about, they screen 100% of the women for Hep B. They follow them up reliably to prevent transmission. The medical records are also connected, which we work across the river from each other, and I can't get information from the hospital, right? I can see it, but I can't get the information.
Right. The patient's complete health history is always available in Denmark, enabling clinicians across systems to quickly spot any care gap and reliably treat it. So that is why they don't recommend hepatitis B at birth. Not because they wouldn't if they lived in the United States. And in fact, actually, after this was made based on theirs, the people in charge of vaccines in Denmark were like, "What? Why would you ever use?
You guys
our schedule?
need it." They said, "You need it."
That's right. Like, don't use our schedule. It is not for you. It is for us. Right? We have good health care.
Because the U.S. health system is fragmented. It's uneven. It's expensive. It's variable. I mean, I've learned that moving, to a more rural area, right? Things are just not available in rural areas.
Access is really dependent on where you live and what insurance you have, if you have insurance, transportation even, and state policies. So, which is why these changes, really based on no actual evidence, are going to be harmful. They are going to cause loss of life. And they will change American medicine for decades to come. After we've done so well at getting so much better at things.
And in actual evidence is 1 in 5 pregnant women in the U.S. are not tested. 1 in 3 who are tested and test positive do not complete the follow-up care.
Yeah, so that's such a big difference when we're looking at those things. So now with these new recommendations from HS, you can still choose to get your child vaccinated for hepatitis B. As of right now, insurances should pay for those. I don't know how long that will last, but as of now, insurance it will pay for vaccines. Just so you know, the kind of some Western states, some Eastern states are going to kind of follow their own recommendations. Oregon is in one, like a cooperative with like California, Washington, and Hawaii. For our standpoint from our organization, we're going to follow the American Academy of Pediatrics for childhood vaccines.
Because we are members of that, and we fully believe they have our back, and they are using science to make decisions.
And for the health of children, like that is their only goal. That is our only goal. And so we are going to continue to follow the American Academy of Pediatric recommendations. And there's actually, I think I included it on the resource too, their recommendations on the schedule.
Which have not changed.
No, it's the same schedule that was previous to this administration. What can you do as people who are frustrated about this? Obviously, we are frustrated about this.
Yes.
And we're going to, like we said, we're going to continue to follow American Academy of Pediatrics. That's what you should do too. Do that research through the Academy of Pediatrics ahead of time. Talk to your pediatrician or to your family practice doctor about vaccines, and then advocate for these things. Like if you value vaccines and the health of your child, then tell people that.
Contact your state representatives.
Yes.
Contact your insurance companies. Like, advocate for your children.
Yeah, because unfortunately, our federal government probably is not going to for the foreseeable future. So with that.
Yes, we're again here to help keep your kids happy, healthy, and safe. We always say it in a different order, which I kind of like. There's 3 adjectives, doesn't matter.
So what's important.
I'm Dr. Joanne Smith.
And I'm Dr. Corinna Hankins. And this is a pod full of pediatrics. Thanks for listening.